Our top story, there's word of a possible thaw in relations between the U.S. and North Korea. Representatives from South Korea delivered a message to President Trump from North Korean leader Kim Jong-un. It was an invitation for the two leaders to meet in person in May. The White House says the president has accepted. The exact time and place of talks still have to be worked out. Also on Thursday, the president formally announced tariffs on imported steel and aluminum. Canada and Mexico are exempt for now. Their status will depend on the results of the NAFTA talks that are now underway. The new tariffs go into effect 2 weeks from today. Montana's congressional delegation had a mixed reaction. Republican Congressman Greg Gianforte is urging the president to reconsider. He says, quote, "These tariffs are a bad idea because they could lead to Montana ag products being shut out of foreign markets. They also will drive up costs for America's manufacturers and serve as a tax that increases prices for Montanans." On the Senate side, Senator Steve Daines says while he supports the president's efforts to narrowly tailor the trade sanctions, he too is worried about their impacts on Montanans. "I support the president's efforts to make better trade deals for the American worker. I remain concerned that tariff will increase costs on Montana working families, farmers, and ranchers." And Senior Senator Jon Tester, a farmer himself, told us he's concerned over the uncertainty the administration is creating for Montana farmers and ranchers. Quote, "We should be fighting to increase export markets, not instigating a trade war that will force Montanans to pay more money out of their pocket." Turning to Crime Watch, Missoula authorities are investigating the theft of a toxic substance stolen from a University of Montana lab. UM Police Assistant Chief Ben Gladwin says the chemical, potassium cyanide, was potentially discarded within the community, but exactly where the vial is unknown. University officials say they cannot rule out the possibility that this vial could be on campus or in the vicinity. According to the Centers for Disease Control and Prevention, contact with potassium cyanide can result in lightheadedness, vomiting, suffocation, confusion, and death. A district judge in Helena heard testimony in a suit that seeks to strike down Montana's law that says only physicians and physician assistants can perform abortions. Two advanced practice nurses who would like to provide the service filed suit in January. They say the law unconstitutionally limits access to abortion. The ACLU of Montana and the Center for Reproductive Rights are assisting the nurses. The plaintiffs are asking Judge Mike Minahan for an injunction to block the law. They say advanced practice nurses can be fully qualified to perform abortions safely, but lawyers for the state argue the law is justified because some studies have found higher health risks when abortions are not performed by physicians.
It's not the letters at the end of a provider's name, APRN, PA, or MD, that makes someone a competent abortion provider. It's their education and training.
The rate of complications are always equal to or greater when a non-physician is performing the abortion. That is the state's compelling interest in restricting non-physicians' abilities to perform abortions.
Judge Minahan did not immediately rule on the motion during Thursday's hearing. In other news, the number of low-income Montanans covered by Medicaid expansion continues to grow, and as an oversight panel heard on Thursday, the expansion has also had a big impact on Montana's economy. Montana's expanded Medicaid program, which provides government-funded health coverage for poor, childless adults, is now covering nearly 94,000 people. The expansion is part of the 2010 Affordable Care Act, also known as Obamacare. The federal government covers more than 90% of the costs, and a study presented Thursday said the program is spending more than $500 million a year on medical care. The study from the University of Montana Bureau of Business and Economic Research also said that money is having a substantial economic impact in the state in terms of jobs and income. The author of the study, Bryce Ward, told an oversight panel that the impact should not come as a surprise.
Yeah, if you take a bunch of money that wouldn't otherwise be here, inject it mostly into the healthcare system, but also into some other areas, you get additional healthcare jobs, you get additional jobs, in the economy. In our state, it appears to be about 5,000 jobs a year and about $280 million in personal income.
The program will expire next year unless the 2019 Montana legislature votes to continue it. Meanwhile, the state of Montana wants more time to develop the draft environmental impact statement for the proposed copper mine near White Sulphur Springs in central Montana. Sandfire Resources America, the company previously known as Tentina Resources, is proposing the Black Butte Copper Project. By law, the state is required to complete its EIS within 1 year after accepting Sandfire's completed permit application. That means the state needs to complete the complex report by mid-September of this year, but officials say only the initial draft will be ready by then. The state is asking to consult with company representatives to see if a new EIS schedule can be worked out. The state is also in the process of reviewing the mine's air quality permit application. Now we go to Yellowstone National Park, where new efforts have been announced to combat aquatic invasive species. Beginning this year, the park will implement a permanent ban on felt sole fishing boots and waders. The felt sole can trap microscopic organisms that remain in the fabric even after cleaning.
It doesn't dry as fast as, say, a rubber, and it can kind of act a little bit like a sponge. In other words, it makes a good house for small organisms to get in there and to stay in there.
Rubber-soled boots and waders will still be allowed. Yellowstone is also adding a boating season. Boats will be allowed in the park between May 26th and November 4th. All watercraft must be permitted and inspected for invasive species before launching in any park waters. Turning to health news, it was around Thanksgiving when Lori Helmy, a Billings woman and breast cancer survivor, started having a hard time breathing. She thought she had pneumonia and decided to lay low over the holiday. But a trip to the hospital and a couple days later, and Helmy realized she would have to fight for her life a second time.
Told me it wasn't pneumonia, it looked like something going on with my heart, which was totally news to me. And so I was admitted to the hospital that night, and the next day had an echocardiogram and was told my heart was functioning at about 15 to 20%.
For sure. Helmy has family history, and her doctors say it's possible chemo treatments that could have played a factor in her heart failure. But at 50 years old, she wasn't expecting heart problems. Her doctor says she often sees women who think their symptoms aren't that serious or think they simply don't have time to go to the doctor.
I think we tend to ignore ourselves, and part of the problem with any healthcare condition is your body does start warning you early enough. Where modern medicine can take care of a lot of things and reverse a lot of the damage. With congestive heart failure in particular, unless it's caught early, a lot of damage can happen, not just to your heart, but all the organs that your heart supplies with blood. I encourage women not to ignore the signs and to sort of not brush it under the rug, as we all know we tend to.
Doctors say some of the first symptoms women will start to experience are weight gain, water retention, and fatigue, which many women often associate with menopause. She says if you have any of these symptoms and they start to become persistent, you should see your doctor. Stick with us here.